Greetings, Eric Backer, naturopath from New Zealand, author of Candida Crusher, formulator of the CanXida range of supplements. Thanks for checking out my video. I'm going to be talking about ankylosing spondylitis today, particularly with its reference to dysbiosis and Candida yeast overgrowth that I see in people. Ankylosing spondylitis is a condition that I see quite regularly in my clinic with male patients. It seems to be more common in males, particularly aged between about 10 to 30 years of age. It's probably about the starting point, and it's one of the rare autoimmune conditions that tends to be predominantly of male rather than female. Most autoimmune conditions tend to really affect women, but this one is really big with guys. In fact, 90% of the people who have AS are in fact male. So there's a gene involved here called HLA-B27 gene. I remember first reading about this in a book called The Four Pillars of Health, written by a New York doctor, Leo Galland. I think it was written back in the late 1970s, early 1980s. And Dr. Galland noticed the connection between Klebsiella, a bacteria, and people with AS. In fact, 70 to 80% of people with AS, when we do stool tests, we find Klebsiella, different types of Klebsiella, oxycarta or pneumonia, or other kind of subspecies to be involved with AS. So I think about 8 to 9% of the general population have the HLA-B27 gene, but it seems to be big with people, particularly a trigger in people with AS. So the Klebsiella bacteria tend to get attacked by antibodies, certain types of antibodies in a person who have this HLA-B27 gene, which causes the inflammation and pain that they tend to get in the lower back. So AS often starts off with the lower back pain, and eventually it gets worse and worse and worse to the point where the sacroiliac joint in the lower back can actually fuse. It can become so painful for these poor, unfortunate people. The hip joints can be involved, the lower back can be involved. I've also seen in some cases the feet being involved, the knees being involved, particularly the lower extremities. It can be a crippling, terrible disease for a lot of young guys to have. It's absolutely awful. I've helped many guys over the years with AS. The first thing I do is a comprehensive stool analysis to determine what type of bugs they've got. Klebsiella we often find, but many cases we find Candida in these people as well. So Candida comes along for the ride. And they may have other parasites. They may have poor beneficial bacteria. They may have inflammatory markers. So I tend to treat every AS case on a case-per-case basis because no two cases of AS are the same. So what do I do with AS? How do we alleviate the pain for these people? Many young guys I see with AS already have been doing things like acupuncture, massage, certain types of physical remedial therapies, to help them with their lower back pain. And they're usually quite good at that. I find that the Candida Crusher dietary approach works quite well. So the MEVI diet, the meat, eggs, vegetables, and yogurt, we look at low allergy, so we usually take the allergens out, the dairy products and the gluten and certain types of foods we'll take out of the diet. We look at repairing the leaky gut, because most people with AS have got seriously leaky gut. A lot of them we will be taking like RA, the rheumatoid arthritis, I've just spoken about in the other autoimmune video. They'll be taking pain relief, which ends up wrecking the gut. Many of them end up on TNF, so tumor necrosis factor alpha blockers. So this is an inflammatory mediator produced by the immune system called tumor necrosis factor. And these drugs block inflammation. But unfortunately, a side effect can be a lot of side effects long term. And many people on TNF blockers long term end up getting off these drugs, looking more for natural alternatives to anti-inflammatory, rather than pharmaceutical, intervention. So Candida is a big thing with a lot of people with AS. So I tend to really work hard out on trying to remove Candida, remove the dysbiotic flora, including Klebsiella. I use my CanXida Remove, which contains the grapefruit seed extract and the oregano, many other components in there, the caprylic acid, the andesinoic acid, the clove, all the other ingredients I put in there to help to clean the gut right up and get rid of this, kind of a bad gut issue that these people have. We clean up the diet, we clean up the gut, and we tend to work on a low stress kind of lifestyle. There's a very positive outcome for AS, particularly if the young person gets involved with remedial therapies, looks at maybe changing their occupation, looking at a low-stress lifestyle, it all has a very beneficial effect. And eventually we can get them off these kind of medications. I'm not against the disease-modifying drugs, but I think long-term use, there will be a price you will pay for these kind of medications. But certainly they have their place with ankylosing spondylitis. This disease can also precipitate psoriasis or a secondary autoimmune disease. And I have seen several cases of psoriatic arthritis and psoriasis combined with ankylosing spondylitis, which is very unfortunate for the person. So, but if it's picked up early and we can correct the gut function early on in the piece, clean the Klebsiella up, which is present in 90% of cases, we can get a significant anti-inflammatory response without having to look at things like pharmaceutical intervention long term. So that's my approach to AS. It's really identifying the problem with the patient, cleaning it up, and trying to look at a long-term kind of a strategy. So, but consider, if you're looking at this video now and you've got ankylosing spondylitis, consider comprehensive stool analysis, including parasitology, 3 samples on 3 days. Look at the report, act on the report. 6 to 12 months later, repeat the report, look at the difference, which I call test and measure. So, test what you've got, treat, and then measure the response. And if you've been successful, you will have a positive outcome both in symptoms and in the test result. And for AS patients, a clever thing to do is 6 or 12 monthly repeated stool tests for a few years to have a look, to gauge how effective their treatment regime really is. Because in my opinion, it's all about the gut. If you get that gut right, fix the leaky gut, get rid of the bacterial imbalance, you're going to be in a hell of a lot position long term. Check out my CanXida products. If you're living in countries like Sweden at the moment or in the EU region, we're working hard out at the moment to try and really remedy this problem in terms of access to these products. It's 2016 currently. Certainly by 2017 we hope to have that issue solved. And I find the CanXida Restore, Remove and Rebuild to be very good products for people with conditions like ankylosing spondylitis. Thanks for checking out the video. Don't forget to click on the link below if you haven't already got my Candida report. And thanks for tuning in.